Now, Beijing's Municipal Commission of Health and Family Planning on Monday announced one more case of yellow fever, bringing the number of reported cases in the country to 4. So far, 158 people have died in Angola. More than 50 died in the last month alone, according to the WHO. Kenya has 2 cases of yellow fever. 1 patient has died. A WHO representative in Angola's capital, Luanda, said on Friday that the possibility of spreading to other provinces was much higher, and deaths due to the viral disease transmitted by mosquitoes has been accelerating. Yellow fever is an acute viral disease transmitted by infected mosquitoes, and it's mostly found in tropical regions of Africa, Central and South America. Maria Galang is in Angola right now, Luanda to be specific. She has more data on this story. Maria, these death toll numbers, frankly, are absolutely shocking. 50 about a month ago, now it's spiked to 158 according to the WHO. What's behind the steep climb?
Well, Rama, before this outbreak, the government had contracted private companies to collect waste around the city. But after a huge drop in oil prices and a cooling demand from China, the government was forced to slash its budget by 40%. And that meant that the rubbish collectors couldn't be paid anymore. And that, added to that, rains in December, stagnant water and mosquitoes breeding in that stagnant water, contamination in cooking and drinking water, that led to the yellow fever outbreak, Rama.
Indeed, it seems like the perfect storm of problems here. But given the budget cuts you alluded to, oil prices have been falling since June 2014. How is the government planning to fund its response to this crisis?
Well, Rama, the government really doesn't have an adequate budget to deal with this crisis. A lot of support is coming from the World Health Organization. WHO is currently supporting the procurement of 7.4 million doses of the vaccine. Now, that's enough to vaccinate the entire population of Luanda and then some. WHO has provided about $290,000 from the African Public Health Emergency Fund and another $500,000 from the Contingency Fund for Emergencies. That's for operational costs to deal with this crisis. So the government really doesn't have an adequate budget, but what they are doing at the moment is they've enlisted the help of the army to help with sanitation. So as of 2 days ago, the army has been going around the city. They've been getting rid of the huge piles of rubbish in Luanda and the suburbs. They've also been decontaminating the areas, the water in which this Aedes aegypti mosquito likes to breed. Rama.
Indeed, we'll keep tabs on that story. Thank you for the update. That's Maria Cristina Galang, of course, live in Luanda. She'll keep tabs on that story.